Right. Thank you. Thank you. Welcome, everybody. Welcome. Welcome from all over, wherever you're watching us from. If you're in Zimbabwe, if you're United Kingdom, America, welcome. Welcome to House of Africa. Would like to thank you all for tuning in. This is one of a kind, I would say, because we have different people from different organizations coming together to discuss this most important topic. I'm really honored. Thank you so much, Konzanani, for allowing us to come and have this show on your platform. And I'll just quickly go straight to the talk show. I'll introduce myself, and I'll let all the panelists introduce themselves as well. So my name is Chido Robo. As you can see, my name is written down. And I'm your host today. And I'm a qualified social worker with nearly 10 years experience. And I also am a founder of a small organization called Family for Sure. I'll tell you a lot about it later on, because today's topic, it actually is something that I'm extremely passionate about. And it's the reason why we actually came together as professionals to come up with this Family for Sure group. So I'll talk to you about it later on. So without wasting your time, I'm going to ask, shall I pick, or anybody who wants to go first, to introduce yourselves, and then we go straight to the talk show.
So I'm Emily Dube. I'm primarily an occupational health advisor. I've got a background in the NHS public health sector, councils, social services, and in the private sector. And I'm also qualified as an employment lawyer. So I do both occupational health and employment law, as well as health and safety law. So that's all to do with staff health, staff legal rights. And it's my whole life is about employers and employees, supporting HR and management.
Thank you, Emily. Mm-hmm. Who wants to go next? Sandra Konzanani.
Okay, Konzanani Lambo.
I'll go in. My name is Mishek, and
Mishek, I think your network.
Yeah, his network. I think.
When I came into UK.
Mishek, sorry, can you repeat that, because your network is breaking off a little bit?
Okay, or maybe where you set the signal.
So,
yeah.
So my name is Mishek from Zimbabwe. Originally, I was an engineer, but now I'm a mental health nurse. So it's a new profession that I trained into. When I came into UK, you know, when you look for jobs, you can't find jobs, and you look at something that you think can sustain your family. But having trained as a nurse, I think it has transformed me as a person. A job I never thought I would enjoy, but I think I immensely enjoy it. It has taught me to be a human being. I'll leave it at that for now, then we can continue as we go on.
Thank you. So yeah, my name is Konzanani Ngobisi Lambo. So I'm one of the members of House of Africa Foundation. And my profession, I'm a pharmaceutical scientist. We develop medicine. So we are not at the forefront, but we develop it and give it to you guys so you can make, you know, people better and stronger out there. So that's all I have to say about that for now. Thank you.
Evening, everyone. My name is Sandra Chikara, and I'm a mental health nurse by background. And also, I'm also a diversity and inclusion advocate as well. And I'm also a volunteer with Family for Sure as well. So looking forward to the discussion this evening. Thank you.
Thank you, everybody. Thank you. So, as you can tell, all the people who are here, mental health, and you're wondering, you know, we've got so many people who've got mental health background. We just thought, okay, the month of May is Mental Health Awareness Month for all those that didn't know. And today, being the last day of May, we thought would be an amazing opportunity for us to do this, have this conversation. I like to call the talk show a conversation because I think the topic itself, mental health, is a very, shall I say, what's the word? It's something that there's a stigma attached to mental health itself. So when we talk about mental health, people are very scared. People don't want to share. They don't want to open up. So I thought, okay, rather than having it as a talk show, let's have a conversation. Let's talk about it. Let's come together as different professionals. Let's share ideas. Let's discuss how have you been? How are you? Start with the question, how are you? How have you been? Who is looking after you? Who are you looking? Who are you contacting? Who's been checking up on you? So this is why we came together like this and said, okay, let's come up, talk about the impact COVID-19 has had on people from Black, Asian, and minority ethnic groups. Because I understand, everybody's been affected in so many different ways. We will be here all night if we start asking each and every one of you, how have you been affected individually? But we're not going to do that. We'll do that another day. But today, let's talk about Black and ethnic minority as a whole, from our profession. Let's take advantage of our professionals who are here, who've given us their time to come and talk to us, give us a bit of information. I don't know, Mishek is just dropped off. I think his network is really bad.
Yeah, you come back, yeah.
So I think it's good for us to just go straight to the discussion because I'm really excited, very, very excited. I cannot wait to hear what all of you have got for us today. And for those who are listening, please grab a pen and a paper. I'm sure you're going to enjoy this, trust me. And get a bottle of water because it's actually hot in England. So you need to stay hydrated, drink loads of fluid. That's another good thing. So let me start by asking a question because that question will lead to our discussion. And what we'll do, because we want to make sure that we are within time. So we're going to try and limit I don't know how we're going to do this, but as I'm hosting this, I'll probably sort of try to chip in when you're talking to say, okay, sorry, thank you very much, so that we can move on to the next, because we've got so many questions. So the first question that I'm going to put out there for us to start the conversation is, tell us how COVID-19 has affected people from Black, Asian, minority, ethnic communities, right? If you want me to repeat that question, I wish if I knew the technology, I would have written it down so that people can see it, but never mind, I'll repeat it again. Tell us how COVID-19 has affected people from Black, Asian, minority, ethnic communities. I know it's a very broad question and it opens a tin of worms, I would say, but let's try to, as we know, it's Mental Health Awareness Week, so we can just kind of direct it to the mental health subject that we're here to talk about. So who wants to go first?
I think we'll let the mental healthness go first.
Okay. Sandra, because Mishek has dropped off.
As long as you promise to chip in, that's happy to get us started. So yeah, I mean, the thing is, I think with COVID, with the pandemic and everything that's happened since the beginning of the pandemic, is that it's actually put more of a spotlight on the existing issues, issues that we're all aware of, but were not a priority focus, so to speak, because the consequences were not immediately apparent to the rest of the population, even though we were living and breathing it, those consequences and those challenges every day. And looking at the social impact in terms of the pandemic, the need when we had lockdown, but the fact that also the vast majority of us are in frontline roles. So people were going out and about, trying to earn a living and trying to provide for their families here, in where they're currently based, but also abroad as well. Also worrying as well in terms of the safety and welfare of those families that were abroad as well, because we didn't know what, COVID was all about or what the consequences were. Hence, we ended up having this disproportionate representation of people of color in terms of the fatalities from COVID. And then also, for the first time in a very long time, we were able to actually just stop and just pay attention to what was happening. So you've got the social implications, you've got the health implications, because you couldn't most of us are living in homes where we are living on top of each other. So social distancing is another challenge. And most of the areas where you find most of us, they are actually also overpopulated. It's not a generalization, but the probability is higher to find people of color in those kind of settings. And also the impact of everyday challenges, the emotional impact, which now research has shown that, the weathering and the microaggressions that we experience by virtue of the way we look or the way we sound actually can lead to physical health issues. And that already puts an added pressure on people's immune systems. So that whole combination actually meant that we were already a very vulnerable group. And then adding the issues around how to manage COVID-19 and what it brought in terms of the changes in the way the world worked, we were actually left very exposed. And no preemptive measures were put in place to protect people of color. Because you'll find, for instance, and this was an amazing initiative that was put together by, I've just gone blank, but one of the mental health services, I think it was and the service that were looking after the homeless. And they preemptively were like, you know what, the homeless are very vulnerable. We'll move them into, safer accommodation until we understand what's happening. However, it was St. Mungo's. It was amazing. But we didn't get the same preemptive measures being put in place for people of color. So that left us very exposed. I'll stop there. You know me, I can till 10 o'clock.
Thank you so much for starting us off. I mean, you've raised some very major points there. Before I comment on the points, I think it's good to just bring Mishek, because I think because you're both from the mental health background, it will be good to hear what he has to say. I don't know, Mishek, did you hear the question before you went off there? It's on the, I think, case I put it on there. Tell us how COVID-19 has affected Black, Asian, and minority ethnic from your professional or even personal. I think it's the same. Can you hear me, Mishek? I think
he's frozen.
You're muted.
Hello?
Hello, yeah.
You can hear me now, yeah?
Yes.
That's good. Okay, so what I was going to say is I think I totally agree with Sandra, the little bit that I heard there. But I will just go back to when we heard that there was COVID, beginning of maybe March last year. Then you look at, I work on a ward and I look after the elderly who are very vulnerable. So we're looking at 65 and above. So they're the people who are very vulnerable. We did not have the proper masks. No one knew exactly what was happening. Then you then get your service managers and above. If you look at the demography there, they are all white. You rarely do you see Black people there. Then when you look at the ward, most of the people who are working on the wards are Asian, Black people. And we are facing this. You don't have the proper equipment. So it's like this day when you listen to LBC, all these, they put all this money into NHS. I'm not too sure where it has gone to. Because from where I am as a ward manager, I've not seen that money coming in. So, and when you then look at why a lot of us were dying, one is because of economic backgrounds. You have to come to work. If you don't come to work, you can't pay your mortgage. You can't feed your family back home. So you don't have a choice but to come to work. you're still driving, you're going home after work, where your children, your spouse can be exposed to the COVID you're bringing from work, but we're still forced to come to work. They never said if you're a nurse, you should not go to work. But what I found even to this day, when you look at the people who are working from home, they are not the band 2s, the band 3s, the band 5s, the band 6s, band 7. It's band 8B and above. Those are the guys that are working from home, and they're giving directions in terms of what needs to be done, but they're not there to see what is on the ground. So it's like, it's probably a miracle that some of us are still alive. Because if you ask me how this COVID is spread, I don't have a clue. I can give an example of a day when I came to work. There was one of our patients was coughing. We decided, let's swab them. The result came, they were positive. So I decided to swab everyone, including members of staff. We ended up with half the ward. They were positive, but we didn't know. 2 nurses were positive, but we're all coming to work. We never stopped. So you can imagine when you listen to the government, whatever that they are saying is actually not true. I wish they would come and speak to us on the ground. Then we can tell them exactly what is happening. So maybe in a nutshell, these are some of the things I've experienced with this COVID. And if there's a power above there, I think that's why I'm still alive today, not because we had the proper mask, not because we were distancing. I don't know why I don't have it. I'll probably leave others to contribute.
Yeah, wow. Thank you so much, Mishek and Sandra. I mean, it's very important to hear what the front line, because Sandra and Mishek, they are both mental health nurses. And to hear, if you remember, last year, every Thursday, we were clapping for NHS. And for some reason, when I was talking to my other colleagues from frontline nurses, they thought they didn't like it, because they said, rather than clapping, why not appreciate us in a different way, financially? We are the most, some of us, we are struggling. Some people have stopped working because of fears around catching COVID, and some people also, they've lost their jobs. Some people are at home right now as we speak because they are worried. They were afraid to get COVID. I speak to a lot of people during this COVID last year when it started. You were highlighting exactly what everybody's been saying, the emotional impact, like what Sandra said. Mishek, you talked about lack of PPE. I remember when COVID started, the panic around PPE, it was such, I thought by now things would have improved. I don't know, because I'm not a nurse myself, but PPE, I think, is still an issue within the workplace. But also, let's not forget the financial, like loss of jobs, financial impact. That's another big one. Anyway, like I said, it's one of this topic. I'm hosting, by the way, so I don't want to look like I'm one of the panelists. I want to give you enough time, because we've only got an hour. We're given 1 hour by House of Africa to have this discussion. So I don't want to say too much. Emily, do you have anything you want to say about the impact from your background? Because I know you did say, you work in a kind of, it's a similar setting. You look after front lines, and then maybe it's an opportunity for you to tell us the good work that you've been doing, so we can have a discussion about that.
Yeah, so it's in 2 parts, really. Initially, when COVID first came, nobody was prepared. Nobody in occupational health, nobody in employment law. They're only just now structuring statutes and laws and precepts that protect and support people. We're only just now making it compulsory to have things like PPE to make sure that the manager is supporting the staff member who's got underlying comorbidities, to ensure that there's a thing called even a risk assessment for a staff member, and a general staff member, and a separate risk assessment for people from the BAME group. That has never been, even the word BAME has not been so bandied about as it is now post-COVID, because of the deaths that happened. Now, when you look at people from the BAME group, I think one of the reasons why there were so many deaths, amongst other reasons, I mean, they talk about vitamin D and other reasons that are being researched, but one of the reasons, this is a group that has got already pressures. So we're a group that's sort of divided. In one sense, we're looking after a family in the UK or in the diaspora. In the other sense, we're looking after a family abroad. So we're under extreme pressure already, whereas the people that live here, that are natives of this land, only have themselves to look after, or their parents looked after by social services. They don't have the same pressures that people have from the BAME group, in that we have so much responsibility on us. And so for us, the reason why most people are here, okay, for education, advancement, all that, but some have stayed on because they're the breadwinner of the family, or they support a family in another country. So that there is that extra pressure, that extra anxiety on a BAME group person the moment he steps into work. To him, it's not just a job. It is like the fruit, the egg that lays the golden goose, egg after egg after egg, so he can feed the other people at home. So there is that added pressure already. And with that pressure comes other ill health, diabetes, high blood pressure, that they manage and cope okay. And we thought they're all fine. But what COVID did was it brought to the surface what was already underlying. So we're a group of people who already have complex problems. We are in a different culture, trying to raise children a certain way, but in school they are taught a certain way, trying to cope with family back home, trying to feed this one and the other, social pressures, family pressures, expectations, work pressures, even marital pressures, because this impacts. And then we have illnesses that we are managing with medication. Then comes COVID. And COVID was the final volcano that just erupted everything that is already underlying. So I would say, so from an occupational health point of view, we were just used to looking after symptoms. Someone comes in with whatever, backache or anxiety, we just bring the tools, do the assessment, okay, send him to counseling. When COVID came, it's a different animal. It's a different type of mental health. It's a different type of physical health, in that there are many other underlying health conditions that are driving this person. So the occupational health practitioner is Eurocentric in their thinking, and they're trying to treat a BAME group person. They have done their training in a fantastic school here in England, and we've learned a lot. But you also have to be equipped in terms of being beyond Eurocentric. You cannot come with a Eurocentric worldview to solve problems of a BAME group person. And that's why we're still going round in circles. Now, we have done things, I'll say quickly because I know you've got time. We have done a lot of things like PPE. PPE is available. I think it is, because I've been doing work in the NHS professionals where we're looking after the whole NHS in the UK. So PPE is available. And there's a questionnaire that we complete for every person who comes into, who's going to go and work for any of the wards or any of the hospitals, to ensure that there's PPE, that they have support from their manager. And this is something that there's a risk assessment that they have to sign at the end of it, and they carry this letter with them. And that they tell their manager if they have any other underlying health conditions. If they don't want to talk about it, they can just show the letter that comes from us that says they shouldn't work this, that, and the other, because that puts them at risk. So PP is highlighted. Support from the manager is highlighted. Reasonable adjustments and redeployment from a high risk area is advised. All that is addressed in this risk assessment form that comes at the end of the interview with each one, particularly those who highlight that they've got underlying health conditions. So we are doing our level best to reach out to everybody. But what we need from our people from the BMA group is cooperation, in that when letters and questionnaires come out, they also need to respond and work with us, and not just leave it. But also, we need to just discuss with them. I think in the pre-meeting, we discussed, Chido, about what are the pressures that drive our people to work. That has not been addressed by the government, you see. So I'll stop it right there.
Wow, thank you so much. And I'm glad you started talking about the work that you're doing, which I think is amazing, Emily. You know, I mean, we've talked about this before, how I value representation. You know, when these kind of things are being done, the kind of work that you're talking about, and we don't have anyone to speak for us or anyone to talk on our behalf. And I remember when we did this pre-meeting, and I said, we can actually take this as evidence to influence your research, because we've got two nurses here and they're social worker, so we can be like representing the people that we work for.
Yeah.
Because I remember you talked about last time that that form when you said if somebody has some underlying health issues, and then they have to put it on that form and then take it to the manager. And we had a discussion around, you mentioned it earlier before you talked about that we look after people back home. So it's not just here that we look after our bills, council tax, you name it. We also have added responsibility back home. Some of us, not just family. Some people are doing a lot of work. They're paying for orphans. They are doing a lot of work within their community. It's just that
family for sure. Yeah.
So people worry now that now the shifts. If I show that letter, will I not get my shift? So I don't know. I don't want to talk too much. I'll leave Mishek and Sandra. What do you think? What are your thoughts about the work that Emily, which is amazing, by the way, amazing work.
Thank you.
It definitely is, and it's definitely needed. And I think one of the things that was really helpful was the introduction of the risk assessments for staff, because for the first time in a very long time, people were being prioritized. And I think also the other thing that COVID has highlighted is the fact that we need to be represented at all levels in the tiers of leadership. And it is already, we've got the snowy white peaks. They already evidence the challenges around representation and diversity in leadership roles. And also, we also need to be there at the table where decisions are made. So that we can actually influence those decision makers. I mean, I'll talk from my personal experience, because I chair our BAME network in my trust, and we were actually involved in the drawing up of the risk assessment to make sure that it actually captured, the areas that would, that will move the risk assessment from being a Eurocentric document, but actually more of a document that would actually serve the needs of the community it was being created for. And I think one of the things that COVID has done is actually highlighted the fact that we need to be present. We need to be at that decision-making table, and we need to have that level of influence to actually shift the narrative, because decisions will be made, regardless of who's around the table, decisions will be made. However, the quality of the decisions is what we're trying to influence. And I think it is about being present, and actually picking up, because even, we're talking about this in terms of the pressures that people, the pre-existing pressures that we're already, dealing with, in terms of, the financial pressures, the emotional pressures, the cultural pressures, and those changes. And also trying to cope with that level of pressure takes away sometimes the human side, the human story, where we stop asking, we stop checking. So if you've got, someone who does the housework most of the time, and they're still doing the housework even through COVID, even through lockdown, how many times do we stop and actually say, how are you? How are you feeling? How are things for you? And I think that's where we need to start asking more of those questions as well. So we check in with each other. Because sometimes the assumption is, oh, this is the breadwinner. Yes, the salary is still coming in. But actually, with what was happening at the height of the pandemic, people were not very sure whether, one, they were going to be alive, to continue providing. Two, that the job was secure, because when we were coming out of lockdown, towards the first lockdown, there was talk of a recession and all of those things. And it's like, okay, what impact is that going to have? And then also, we were constantly, almost every single day you were hearing of the passing of someone not too far away from you, and sometimes even within our own families, or someone you had spoken to about a week ago, really, and so all that uncertainty, it's about us actually acknowledging that, and actually saying, you know what, we've survived that, we've survived what has happened, thank God we've made it through as a community. But also, whenever you survive something, and this is not a test of resilience, it's, it still leaves a mark on you. And I think that's where the whole mental health awareness conversation comes back to. The fact that you survived is great and is to be appreciated. But how are you now? How do we support you now? What are the pressures you're facing now? Because those pressures that were there prior to the pandemic are still there. And in some cases, they've even intensified even more. Because the pandemic is not just where we are, it's also beyond the borders. And how do we maintain our hope? How do we maintain our energy? How do we maintain each other? So.
Yeah, Sandra,
Sandra has got a point there.
Yeah, sorry. Over to you, Mishek.
Now, I was just going to agree with what Sandra has said there. And also the fact that you mentioned the risk assessment is a very good tool. But for somebody who is looking at a mortgage, they will not be truthful, but they just want to come to work.
Yeah.
That is where the problem is. Some people, where they knew they were positive, but they still came to work. The reason they still wanted to fend for themselves and also for families abroad. So I think it's a question of what can be put in place to support people, and also for people to understand and to be truthful to ourselves.
Yeah.
If you're not well, you're not well. If things are not okay, you need to speak out. Like you also say, Sandra, I used to chair our BME network within the trust where I work, but I'm still part of the executive. We talk about some of these things. As Black people, I don't know what it is exactly. We cannot come on the table and say it is exactly as it is. We try and hide. There's something we are afraid of. I'm not too sure what it is. But I've also begun to encourage people to have that courage to challenge practices that are not okay. Example I want to give is just about 2 weeks ago, I was speaking to the director for nursing, and I posed a question, and I said, when I went to where you are giving vaccines, I noticed most of the people who are actually giving these vaccines are band 8. All of them were band 8, and they're all white. So you want to encourage me to have a vaccine. I'm a Black person. And I go there, I don't see a person of my color. What message are you sending? Then why are they all band 8s and above? Some of them are actually physiotherapists who had 1-day training to give the injection. And yet we have nurses who are band 5s who can also have that opportunity to come into some of these clinics and earn the same amount of money that these guys are being paid. Because they're being paid 35, 40 pounds an hour to come and just give a vaccine. And this is where things are just not right. But we now need to start speaking about these things, expose them and talk about them. I think that is one thing that we need, not just the question of I'm coming to work, but we also have to ask the questions, why is this happening? Because I also pose the same question. What happens if all my nurses fall in sick and I don't have anyone, whether bank or agents, to come and cover? Can one of you, because you're also trained nurses, can you come and cover on the ward? I've never seen that since the beginning of the pandemic. I've never seen like anyone who is band 8 and above coming onto the wards to come and support the junior staff on there. So these are some of the things that we also need to go out there, speak to our colleagues, because if you look at it, most of the nurses are Black and Asians. We just need to have that voice and speak out about it. I think that's one thing that I just wanted
If I can come in just to add on
point
to
out
what
on
you
there.
were saying, Mishek. I mean, the thing is, I agree with you, and I think this brings us back to the issue of representation, because when people are being redeployed, when resources are being allocated, it is done at a senior level, and if we have people who look like us, or people who look like us, or at least sound like us, or at least our voices are heard at that decision making table, then these kind of conversations land in the ears where they need to be landing, because it's about not just challenging everyday experiences, but also challenging the status quo in terms of, there are 20 seats at the table. Why is there no one who looks like us at that table? So how do we get to that table? How do we support each other to get to that table? And when people get to that table, how are they also leaving the ladder for others to climb and follow them to that table? Because some of the challenges, I remember when I was still a junior nurse and starting out, and all excited, and I was gonna heal the world and all of that. One of the things that someone said to me was, you need to understand, if ever you are interested in a senior leadership role, there's only one seat for a person of color at the table, and we are all fighting for that same seat. And this is the approach and the advice, and that has been going on for a very long time. And for me now, having had my own experience and gone through my own processes, I always say I'm a survivor of systemic discrimination and all of that. That's the way I see myself, because it's coming out at the other end. And one of the things that I appreciate is that we are having more and more people of color who are actually creating a table and inviting others to that table. And we need more of that, because it's not only one seat. If the table has 20 seats, those 20 seats should go to the people who are best placed to actually affect change, and affect change for the wider community. And this is why we need to be building each other. And on the other hand, we need to also be challenging each other, and holding each other to account. Just because you and I look alike, if I see you not doing the right thing, I don't look the other side. I still need to challenge you. And I think, and it also goes slightly away from our culture, where, there is someone who's older than you, or is a particular position in the family hierarchy. You don't speak up against them, or you go through somebody else if you have concerns. However, when you are in a work environment, I'm not saying don't be respectful, but let's be professional as well. Because a lot of people, unfortunately, left us because people did not stick to the things that had been put in place to protect us and to protect each other. So there is a challenge amongst ourselves, and then there is a challenge, of the establishment. And both those things have their impact. And it also brings into focus, when we actually have people who are fighting for our voices and advocating for us, that we also need to support them. So whether it is, being part of a survey, putting your hand up to be to be a volunteer, whether it is stepping up into leadership roles, which may not necessarily, bring home the thousands, but will actually have an impact. We need to stand up and be counted if we are going to make a difference. Because unless we do that, our voices will continue to be silent. And I think there's someone who actually shared an article on LinkedIn recently. I think he's actually one of our countrymen, actually. And he works in EDI, so Equality, Diversity and Inclusion. And he was like, it's one of the thankless jobs. You almost like, you're a referee in a football match. That's the team that never wins. That you are always challenging the leadership. And people are always like wondering, what are you bringing? but then also you're representing the voices of individuals that have been disenfranchised, who have not been looked after, who haven't been supported, and are frustrated, and they need to see change, but they need to see change right. So how do you manage that? So I also think when we actually have people in those roles, we need to support them.
Yeah. Yeah.
So,
Can I come in? I agree totally.
Yeah.
Can I just come in there? I know we can wind down soon.
Yeah.
I think both Mishek and Sandra have highlighted some very valuable points, and I will just add in. If we look at history, there's been different stratas in development of the BAME person in this country, particularly. If we talk about America, it's another story altogether. They are at a level of fighting for their rights that British BAME are not yet. So we came in as initially what you might want to say floor workers, shop floor workers, technicians on the shop floor, nurses, doctors, practitioners. We were thinking about money. We were thinking about getting a position, a house, bringing the next generation into England, some of the first ones who came here. And so our mind was so much on focused on the self and the building of oneself that we didn't think about challenging things that were unequal. We were happy with getting a salary, getting a visa, getting a house, a mortgage. We were satisfied. And our next goal was more family focused than being the shoulders that our next family members will stand on in terms of the public. So I think we're more focused on that than we were on leadership. So now when you start talking about we need to have representation at the table, yes, we do now. We've woken up. We must move from being technicians, workers, earning money, which is great, to the next level, which is coming to this table that you're talking about, Sandra, to represent more and to be a voice instead of being told what to do. I remember last time you mentioned, instead of being invited to this dance where someone else has written the music, let us be the ones that go there with our music. So that is the next level. So the generation that has been from, I don't know what year it was when we first started coming here. I mean, Jamaicans came here in 1942, but thinking about Africans, our initial goal was building for our children, building for people at home. We were not looking up to think about, and the person at the top was like, yeah, you're doing very well. Well done. Here's your PDP. You've done well. Next promotion, you've done well. Until you knock the door and I want to come into that higher position, like, no, that's not for you. But that was politely said, right? Because we make the decisions up here. So now it is up to us we need to decide. We put limitations on ourselves. I remember Mishek mentioned a risk assessment is completed, but I've got problems at home, I've got to work, so I'm going to lie on the risk assessment. We put limitations on ourselves. We really do. And we need to put people in place where, okay, the risk assessment has been designed, that policy has been covered, I've ticked it, the government have ticked, yes, we are looking after BAME, don't you know, we've got this policy in place. But we need to interrogate window dressing versus reality. And where there is no reality, we put representation there, like Sandra is saying, like Michelle. Yes, they can fill in a form, they can lie, but you don't understand the pressures that they are under. And that's why I meant when I said we need people there that are not just Eurocentric focused, but who've got to focus, who are Afrocentric, whatever centric you want to call it. And also, Sandra mentioned, I'll round up quickly, we come from a background of honor. Honor is important to us. We will respect the senior person because that's just where we come from. So now this juxtaposition of trying to think I can tell this manager I don't agree with you, this and that, we don't want to seem as aggressive, as loud, and as dishonorable. So again, that's another area of behavior that we need to modify. That to question is not rude, because we come from a background where to question is rude. But we need to know that, and those are things that we need to teach one another. And Sandra was saying, support the person who's at the top, and then create a ladder for others to come up. Those are all conversations that need to just keep going. We need to, but primarily, let us move from being technicians, good technicians, the best, to being leaders. Even though you're not, originally from here, but be a leader. And a voice for those that are coming up. So let's remove limitations from ourselves. Sorry, Lo, she don't carry on.
before Kaiser speak, because I know you are itching to speak. I
Yeah,
just
because
think
they highlighted a few things. I'll
yeah.
come in.
I'm gonna give you a minute so that we can come in and say what you think. But I just think it will be a good opportunity for us to ask House of Africa, because I can see I have so many people commenting right now, and I haven't even read them. I'm gonna highlight some of them, but maybe House of Africa to allow us to have these conversations, because you see, we are here to talk about mental health, but look at what we are talking about: leadership skills, and House of Africa being the house to empower people to become leaders and agents of change. So I think this is an amazing thing that Emily, Sandra, and Mishik have actually highlighted, and we're the right platform where we are all coming here to have this discussion. Maybe the next discussion will be, how do we empower ourselves to become? I'm sure Kayser has got another talk show lined up to talk about leadership. But before you come, can I just read one, because this person has been sending the same comment, and I think they are itching for me to just say it, so that, and then Kayser, you can speak after that. He wrote it twice. He said, we need more supporting groups for BAME, full stop. So he didn't say for what. So we were talking about leadership. That's another support group. We're talking about mental health. That's a support group needed. At all levels, we need to have support, because we've never felt like what Emily and all of you have said. We've never talked. We've never thought to go up and challenge things, because whether it's lack of confidence, I don't know, fear of losing your job, there's a lot of fears, that people have just become so comfortable to be where they are, if I may say that. So I think we need to have this conversation. These are very important conversations. If we want to be leaders, we need to be empowered to be leaders. Kaiser, let me give you your minute before we go to the next question. We haven't even said anything yet. Kaiser,
Okay.
you want to say something?
Yeah. Well, yeah. I was listening to all of you guys talking. You highlighted a number of things and stuff, and speaking about leadership and stuff, and trying to come together, empower one another, educate one another as well. When there's information out there, we bring it to our community and educate one another. And Sandra also highlighted just another important thing. She mentioned that when she joined nursing, she was communicating with some people and stuff, and they told her about going up, that there is only one position, and all of you black or ethnic minority people are competing for that position, you see. So that was sort of like a negative thing that they were saying to her. But such things, we can turn them into a positive, because we know that we need to be represented at the table. More of us need to be there. But then what we need to do as well, as black or Asian people, we mustn't compete. We must work together, because other communities have done it before and we know it's successful. And the other other example, other community that has been doing well and they've been successful, like the Filipino community. There are a lot of nurses who are Filipinos. They have groups that represent them. They are not competing against each other, but they are together. If you touch one Filipino, the rest will come in, and they come in with one voice. And that's what we need to understand, and learn fast as black people, that we need to be together, and people need to represent us. And leaders are not just leaders because they are at the top, but all of us can be leaders. We can empower one another. When we do that, we'll put more pressure and we'll be able to change, the status quo. That's all I have to say about that. I think
Thank you
later
so
on
much.
we'll go to the vaccine thing. So,
Yeah, the
and
vaccine is a
it's about
subject that
educating one another, because
yeah,
we
definitely.
don't,
Yeah, yeah,
inform. Yeah. Okay. Yeah.
yeah,
Thank you.
definitely. Thank you so much, Konzanani Kaiser, for that contribution. You see, you're just talking about the same thing: representation, leadership, representation. That's all I'm hearing from all of you. I mean, let me take this opportunity to just read some of the comments, because we want to engage our viewers so that they know we are not ignoring them. It's just that we've got the most passionate panelists that we could ever have. And that's why we're going to have another conversation by default. We have to. So yeah, I can see one that's written there. Yokai Taruinga, she's been commenting. Thank you so much, Yokai, for what you're doing behind the scenes. She says it's about change of attitude. That's the other comment that she wrote there. She also wrote that absolutely those are the hard realities facing front lines. I think when we were talking about PPE, lack of PPE, more support needs to be given to our heroes. Yeah, that's absolutely right. Yeah, okay. Thank you for that. And then we've got Blessing saying BAME group are more likely to be living in areas with higher exposure to COVID infection, which could result in more cases of COVID-19. I think, Sandra, you also mentioned that as well when we were talking about not having enough space to social distance. You know, we live in the most deprived areas. We're living on top of each other. I'll put it exactly how you put it. Yeah, so that's increasing the risk of COVID. And then Blessing also says, I agree with you on the underlying health issues, which we don't report at all. We need more supporting groups. So he keeps on saying that we need more supporting groups. So before I ask the next question, which is us rounding off, I know, Kaiser, you wanted us to talk about the vaccine, but I'm just looking at the time.
Okay.
I think it would be if we do another one of this, because you know why? Because I want us to bring out we've talked about the problems. I want us to talk about the solution as well, because I can see some people sending message on WhatsApp to say, hopefully we'll come up with a solution. Because a lot of this conversation, they come up with just a conversation without, and then what? Yeah, sorry.
Apologies, Chair. People are saying we have to give you a little bit of time, and then we can talk more a little, maybe 15 minutes or so. So I agree with that. So we can cover a few things and then we wrap up.
Thank you so much for giving us. Are you sure you're giving us more time? Because look at the panelists. We are ready to go on another hour.
Even the panelists are agreeing. I'm behind the scene, so don't worry.
Yeah, thank
the
you
panelists
so
are on board.
Yeah, thank you so much for allowing us to go on. Remember, this is all these people's passions, and we've come up with the most influential people, some of the leaders in our BAME groups who are empowering us, shall I say, to be the voice. You know, we have Sandra, who's leading a BAME group, Mishek, a senior, Emily, lawyer, and all the titles I can't even remember, so many of them. And Konzanani, the pharmaceutical. These are the people we look up to, you guys, and thank you so much once again for coming here to talk about, giving us your expertise and to have this conversation. I hope to have more of this conversation because I think it's really needed. Right, let's go on to the vaccine. I know, Kaiser, you're giving us extra time to talk about the vaccine. I know that. Yeah, so
I know. Yeah. Okay, I will kickstart.
The impact of COVID-19. It is. I'll let you start this conversation. Yeah, over to you.
Yeah, I'll kickstart. I know Mishek has got a lot to say, and everyone else. So, and we were talking about leadership, about educating one another, informing one another, and we know that, with regards to this vaccination, people had, we were divided, but then who was there to reach out to our community to come and tell us, like, um, information that was authentic, of not all these rumors that we hear about, or conspiracy theories and all these other things and stuff. And we cannot blame our people as well for thinking like that, but we need to come together and just share that information, and then in the end, people who have, like, you make an informed decision whether to take that vaccine or not. For personally, for me, I'm from the pharmaceutical industry and stuff, and we, follow a lot of protocols and stuff when it comes to pharmaceutical industry. And I do understand, the reason why people were so skeptical and stuff. But when it comes to this, vaccine, when people are getting vaccinated, there is a lot of information when you get vaccinated. It's out there. And then the other thing is, when it comes to pharmaceutical companies, we are a regulated industry. There's MHRA, which is an independent body. So they went through everything, you know, and they decide on how, the medicine or this vaccine must be given, depending on the information that they've, gathered, the information that is like public or even not published at the moment. You see? So as far as I'm concerned, and with what has happened, people getting vaccinated, more than 1 million people got vaccinated and stuff, and we had less, um, um, less feedback that was more like negative or whatsoever, or people dying and stuff. It's been successful as far as I'm concerned. And then the technology again that they were using to make this vaccination, it was a previous technology, you see, which was used in SARS cases, you know. So that's the information that's out there, and this is the information that we need to deliver to people so they can make an informed decision. So there's no conspiracy theory or whatsoever. And when it comes to, I've heard, people saying, "Oh, there's a microchip in the medicine." But a microchip, we're talking of something that is you can see with with your eyes. So this is not nano. I'm not talking of nano. So there is micro technology where some companies they put a chip in people's whatever bodies and stuff, but there is no way there is going to be a microchip in this vaccination because we're gonna see it. So that's
Yeah.
another thing that we need to tell people out there that what this is what it is, and then they can we can learn because we have to learn from one another. I don't know everything, so someone else knows something, so I can learn from other people, and the information that I have I can also put it on the table, so we can build confidence and then make informed decision. So yeah. And then again, I understand this issue about these things that happened in Africa, because they also in the beginning they wanted to take this vaccine to Africa and do some clinical trials and stuff. um I mean, in 1996, I think, when Pfizer went to Nigeria to to test this drug, which was meant to cure things like meningitis, and then they tested about 200 children, and they some of them died and some of them became deformed and stuff, and people did not know about that information was not um, shared everywhere, just because we didn't have like technology and stuff and all those things. And well, the people that knew about it, they became worried about those things and stuff. um, and we understand the reason why. But what we're trying to say now is that such things, yes, they have been happening, and this the vaccination, which is we the vaccination, obviously. What's the point? What's the point I'm trying to drive home? Yes, people made a lot of noise about the vaccination, which is a beautiful thing, and they stopped it from going. They stopped these people conducting the clinical trials in Africa, which was a beautiful thing. So yes, we know, yes, there are worries and stuff, but things have been done properly now, and they're vaccinating people in Europe and also everywhere in the world, and we haven't, seen any side effects or whatsoever. There is no microchip, and I don't believe that this is a, 666 thing, a mark or whatsoever for those who are Christians and stuff. I'm a Christian too, so anyway, that's all I have to say about that for now. Some people can come in.
Thank you so much, Case. I can tell this is your passion. With the way you were talking about it,
Yeah.
it's up your street. I don't know, Mishek, Sandra, Emily, do you want to chip in on?
I think if I can just come in quickly, I think, and thank you for that. It was very, it covered everything about the vaccine, and I think it's those assurances that people need. And looking at the vaccine, I think you've got two different sets of issues. You've got the issues about people's uptake of the vaccine, where we are now, but also the concerns for people who are back home as well, in terms of, they don't necessarily have the same governance processes and systems in place like we do here. And I think that's another conversation. But for me, I'm going to focus on our local situation. And from my own journey in actually, eventually having the vaccine, I had my misgivings and I had my concerns, like you highlighted. And it was, okay, I have it, but I'm still not 100% protected. So why am I having it? It's a virus, so my immune system needs to be boosted. What kind of things can I do to boost my immune system? Would that be enough without having the vaccine? All of those kind of questions. And some of them have been answered and some of them haven't necessarily been answered. However, would I rather take something that will give me some level of protection, or would I rather take my chances with something that I don't fully understand, that has already taken, so many lives across the world? And I think those are the kind of conversations that we've been having really in our communities and in our family, with our families. And it brings us back also to the whole issue of people not being holding back, especially in terms of the risk assessments or how unwell or well they are. That, and this is something that's someone else actually mentioned in a webinar during at the height when the vaccine was rolling out. And they were like, think about it this way: who will look after your family when you are gone? Who will continue going to that shift to keep putting food on the table for your loved ones? Because you cannot pour from an empty cup. You've got to look after you first before you can look after all these other people that are depending on you. And in the event that something happens to you, how are they going to cope? And so those are some of the difficult, conversations we've been having to have in our communities by virtue of how things are set up and the socio-economic pressures that we experience. I mean, for me, when I had my vaccine, I actually kept a video diary of my first vaccine. So I'm yet to have my second. And I just wanted to share my journey before the vaccine, during having the vaccine, and then post. And because some people have had minimal reaction to the vaccine and some have been actually quite unwell post the vaccine. And one of the things that was reiterated to me even before I had the vaccine was that it's very important, because you don't know how you're going to respond to it, have a post-vaccine action plan. Because you may feel a bit groggy or unwell for about 2 days or 3 days. Some people have felt unwell for 5 days, but you don't want that added pressure. So pre-plan for your vaccine, so that at least when you do have it, you don't have that added concern. Do I think I might grow 3 heads in 10 years' time? Who knows? I'll be blessed to actually have survived you know, to be around 10 years from now. And imagine all the life I'll have lived. You know, but at least I'm having something that I know I'm going to recover from. And it will help me get past this, particular point in time. So I would definitely advocate. And I would say ask as many questions as you can, and the resources are there. But yeah, there's only one you, so think about it that way.
Wow, thank you so much, Kaiser Sandra. I mean, you've just nailed it. I think you've covered all the worries, shall I say, because statistically, people from Black and ethnic minority, they're not taking the vaccine. Most of them are not. We have the lowest number of people taking the vaccine, shall I say, rather than not taking. Some people are starting to take it, doing their own research, which is good, but there's still that split half and half, where the others are saying, well, there is something there. And it's nice to hear from, like Kaiser from the pharmaceutical saying, there is no microchip, everybody. Please do not believe what the conspiracy theorists are actually saying. So, because I've heard that, I've seen WhatsApp groups have been so busy with that, don't be fooled, the devil 666, I'm a Christian myself. So I know the fears that people are going through, and that's why we are having this conversation. Isn't it amazing that we are talking about this openly without even worrying about our pastors, that we are going to be told off for having this, telling people to have this 666, vaccine. I'm not against pastor, by the way. Please don't shoot a messenger. I'm actually a Christian myself, born again and happy. But I just think it's good to give people the choice and the information so that people can do their own research, like, having a panelist like this who are knowledgeable in the area, and then go out there, explore on your own and make that decision, And then if you want to have it, go ahead. If you don't, then yeah, that's good as well. We are not forcing people to have the vaccine. Mishek, I don't know, have you got anything to say about, because you started the vaccine conversation, if I may remind you, Mishek, when you said in your words, I remember I was listening, that, people have not had the vaccine. So I'll put you on the spot. Have you got anything that you want to say about the vaccine?
All I can say is I have had all the two vaccines, the first and the second. I did not experience any side effect whatsoever. I've also managed to encourage most of the people that I work with who are also from a BME background, and all of them have had it, and none of them have suffered any consequences. So it's a question of just encouraging one another. Like everyone is saying, it's kind of conspiracy. I'm not too sure what it is exactly, but I don't think that does exist. The reason why I'm saying that is I was listening to LBC the other day, and there's the MP for Hackney, the Labour guy, I've forgotten his name. He said a powerful statement in one of his programs. He said, if this vaccine was meant to kill the black people, how come they're giving it to the conservatives? They wouldn't want to kill their own people. So why are you afraid of having it? And I thought that was such a powerful statement. So I think that's what I maybe would want to encourage people to say, I've had mine. I think the second one, I had it over a month. I'm still here.
And you have no
I've never suffered any issues. So I would encourage people to go for it. Thank you.
Thank you.
No, not yet. Yes.
We can reassure you that you're still, with one head, you don't have four heads. Yeah. So those are the conspiracy theory. I think that's why the vaccination conversation, I like to call it, we may, if we are allowed to have another conversation where we can even probably invite some of the doctors as well, and just have this, because it's because of the fears that a lot of people are having anxiety problems. Let's link it to mental health. Everything we're talking about is very crucial. A lot of people are having high levels of anxiety, depression, because of the vaccine. I know people in church saying, oh, I'm worried. Pastor, pray for me because I'm going to have my vaccine. I'm going to die. So there's a whole lot of, people who are worried about this. We may laugh about it to say forehead, but let me tell you the truth. Some people are having sleepless nights. People like carers, frontline workers, they are feeling forced to have the vaccine. I think it will be an amazing opportunity to have maybe another discussion allowed by Kaiser, just to bring in some other professionals to talk about the fears. Because if we are afraid, we will not lead. We won't be leaders of change, because we can't tell people to have the vaccine if we don't know what we're injecting in our system. You know what I mean? Yeah. So, but thank you so much. Those were amazing. I don't know if Emily have anything to say about vaccine, or you're going to pass on this one.
I'll just ask a question, which is a question I had for myself when all this started. And I was one of those who was really terrified about this is targeted against a certain group of people, as has happened in the past with various groups. To eliminate, you just do certain biological things and they're gone. So I remember being fearful of that until I asked myself the question, where did this virus begin? Yeah, it began in China. So it was the Chinese who then started to run around looking for a vaccine and started vaccinating their own. So if it was meant against a certain group of people, i.e. the Black people, why wasn't the vaccine first given in Africa? Those are questions that I've asked myself. And then the virus was in China, then was it Spain, Italy? They were hard hit before Jamaica, Zimbabwe, and all those, yeah? So the vaccines, people were dying in Spain. It was terrible. And so the scientists there and pharmaceuticals, they were already thinking about a vaccine to help their people way before they thought about vaccinating the African people. So those questions I asked myself, where did the virus begin? And so hence when did they first think about a vaccine? Was it first when it hit Africa, or was it when it hit China and Spain? So ask yourself questions.
Kaiser, over to you.
I'm tempted to say something. Yeah, you remember when I highlighted that, when they developed this vaccine, they used the technology that was already existing, which was, performed on the SARS cases. So it wasn't something new. And the other thing is that they threw a lot of money because it was urgent, because, it was everywhere. So they had to do something as leaders to serve, people in the communities. So if the technology was not something new, it was the technology that was already there, because, scientists, they do research, they work and stuff, they work on these things. So they just used something that was previously, used on the SARS cases. So people need to understand, need to know that and stuff. And
I think we need another vaccine talk.
Definitely. I mean, we will be here all night if we start this conversation, because I know while you were talking, I've got someone at the background saying, ask this question. I'm actually ignoring him to say, not today, because we'll start another 1 hour conversation based on one question. So I think let's see.
Blessing is saying something. I think the problem is underrepresentation of brown people in these studies. Okay. Underrepresentation in clinical trials. Okay.
Yeah, that's a very good point. With the clinical trials not having people from Black and ethnic minority background. You see, I'm not going to poke you, panelists, because I know you would have something to say about that, because all of you are very, what's the word, passionate about representation, like I am. If we do not have representation, we will be having this conversation and nothing will position. But where I come in, why I'm here, probably people thinking, why you're not from House of Africa, you are not, I am from Black and ethnic minority, as you can see, and I saw a gap towards last year. And I was one of those people, like everybody else, who would talk about the gaps to say, oh, there's a lot of, we don't have any services for Black and ethnic minority. People are struggling. People are lonely. People are asylum seekers. And I would highlight all the problems. And I love talking, as you can tell. But one day I just realized, come on, I need to do something. I need to make that step to make a change. And then that's when I came up with the idea of Family for Sure, which was an idea which came up because we've identified a gap where there were people from Black and ethnic minority who were feeling very lonely, especially during COVID, who were experiencing mental health problems, domestic violence, asylum seekers. We did not find in the area no befriending service whatsoever. A small thing like someone to talk to. You know, we underestimate things like that. These are very important things. We may think, oh, we want leaders, we don't need representation. People are suffering in silence. People are going through domestic violence in their own homes. We have not addressed the issues that are stopping us from going to represent our own, if you know what I mean. So I felt, let's start from here to fix ourselves by helping each other come out and talk about our problems. And then I assure you, we would be talking to these people as our representative. Because imagine if you're helped by somebody, tomorrow you'll be the advocate. Is that the word for those scholars who are in the building, Emily? No?
Yes.
Yes.
Yeah.
You can advocate for what you represent. I'm a strong believer of representation. I can't go up there and say, well, I'm going to speak for Black people, or I'm going to speak for underrepresented, when I don't understand the issues of an immigrant. I'm an immigrant myself. You know, I have issues around people. I know people worry about accents. Oh, will they understand me? Don't worry about it. Just go and be yourself, say what you feel, represent your group, and together, trust me, we are stronger together. I don't know if you can see my t-shirt, which I was given by House of Africa. You know, stronger together. We can never do this on our own. Trust me. Anyway, let me not ramble on. Let's go to the next question, which I don't know if Kaiser, because I can see you always want to say something, but I'm cautious.
We're done. We're following you. Yeah. Maybe we've got 10 minutes left. 10 minutes, then we.
Yeah, so good. That's brilliant. So 10 minutes will give us the opportunity to go to this question, which is actually closing, or shall I say summarizing, on what advice would each of you have for somebody who's going through some form of mental health, be it anxiety around taking the COVID vaccine. So it's just to talk about what we're talking about. What advice would you give them? That's number one. And number two, what advice would you give anyone who's just going through some form of mental health, any support that you know, any support group or anything? A nugget, I'll call it a nugget, a goodbye nugget from all of you. Who wants to go first? If you don't, raise your hands. I'll pick.
I think I would say, if you're going through mental health problems, just a nugget, immediate thought: don't be alone, because when you're on your own, you get more thoughts come to you, some that are not very helpful. You need to voice your thoughts to another person. Find somebody that you can talk to, and then they'll signpost you to the right clinic or help if that's what you need. Don't be alone.
Thank you.
Yeah, that's what I would say. Yeah, just from. And what was the other question?
I think you just did this one on the same thing. So if you're going through mental health or worried about vaccine, put them together.
I'll leave the vaccine to Kaiser, but I think the mental health one first. Talk to somebody, and then if you need signposting, they can lead you to a professional if you need that. But don't be on your own. Don't do that.
Thank you very much, Emily, for that. And anybody else? Mishak? I saw you unmuting yourself.
I think what Emily said, that's the truth. I think we just need to be open about it, be transparent. We know mental health has got a lot of stigma. But if you also look at what's happening nowadays, with people like Harry really coming out and talking about it, the more you talk about it, the better you feel within yourself. So we actually just need to encourage one another to be honest about some of these things. Just like we're talking about COVID. You can come to work, you are not well, but because you just want to make the money. But if you are honest enough, I'm sure there will be supporting systems in place to help you. So that's what we actually need. Let's just be transparent about it, be open about it, talk about it. I think it's also a subject that we should be able to talk in our families. A subject should be able to talk about even in church. We should not stigmatize and call it a demon, because these are actually real issues. That yes, prayer can help, but sometimes when you talk to somebody, you get the solution. I have experienced even in family members who have suffered mental health issues and have come there and have said the little knowledge that I have about it and helped them. When I mentioned it, at first, I identified a problem. I became like an enemy. But 6 months down the lane, people started coming back and say, thank you very much for the help you have given me. Thank you very much. You have saved a life that would have gone into drugs and what if we could have lost our child. We need to just speak about it and be honest and be open about it.
Oh, thank you so much.
Thank you.
Thank you so much. And Kesa or Sandra, who wants to go first?
Ladies first.
Shall I jump in? Oh,
Yes.
thank you. I'll try and quick. I think just to build on what Mission earlier already said, I think one of the other things, especially when it comes to the vaccine, this, ask if you've got a question, ask the question. Because 9 times out of 10, there'll be somebody else who's got a similar question. So there's no ridiculous questions or stupid questions when it comes to your health. So please do ask the questions when you have the opportunities, or reach out to somebody who you can get advice from, whether it's your GP, whether it is occupational health, wherever it is, the information is there. Just ask. And I think that's really important. The other thing is, and then this is one of the reasons also I have to say thank you for having me on the panel and the privilege of being part of this conversation, because I think mental health awareness is crucial if we are going to sustain ourselves and our communities. And the thing is, if you are not feeling great or well, you are the expert on your own mental health. Mental health is about life. So talk to somebody. If the first person dismisses you, keep talking until you find someone who actually validates the way you're feeling. There are services. There's the befriending service that Chido talked about. You've got your GP practices. The support is there. Talk to somebody. Because what tends to happen is we tend to hold on to things and say, oh, no, I'm fine. Something changes in our life and we're like, yeah, I survived it. I'm fine. It still has an impact on you. And unfortunately for most of us, it's the end results. We wait for a very long time before we actually seek out help. It's only when something drastic happens that we actually seek out help. And by that time, things are so out of control. So the earlier, the better. When you start feeling not so great, talk to somebody. And also don't assume just because someone is able to get out of bed and go to work, get out of bed and make sure that you've got your meals on time every day, or make sure that the home is cleaned and tidy, or that they're able to do their schoolwork and they're achieving in school, and all of those things. Don't assume that they're okay. Talk to your children. Talk to your spouse. Talk to your friends. Talk to each other. Even when you are just, a group of guys hanging out, check in with each other. Ladies' night, or ladies' night. Let's check in on each other.
That's true. Powerful.
So thank you.
Thank you so much.
Can I was just going to add something that Sandra mentioned.
Your time, Mishek, but it's okay. For now, I'll let you. I'll let you off. Go ahead. Before Kesa comes.
Okay. Right, there's something that Sandra mentioned earlier on when she said, we work with mental health patients and what have you. It's mostly the focus is on our patients and the focus is not on our colleagues. We should be able to ask this question, how are you? And we don't ask those questions. So that's one other thing that we also need. talk about. Then nowadays, they're also employing lived experienced practitioners. Amongst ourselves, there are also people who have suffered mental health. Let's encourage those people to share their journey. I think it also helps, rather than just talking about it. In church, we talk about testimony, but we can also talk about lived experience. This will help. If you hear that Mishek suffered mental health, now he is okay, I think that on its own can go a long way in terms of bringing other people to also understand what mental health is all about. So sharing our experiences helps. And especially if you share your life experience, people tend to listen to it rather than something you've read in a book or you watched a movie, but you're talking about something in reality, it goes a long way. Thank you.
Oh, thank you so much. Thank you. And Kayla?
All I can say is that, as a people, let's make every effort to make an informed decision. So with regards to our COVID-19 and the vaccine and stuff, I was one of the people like who was also skeptical because when they brought this vaccine, it was like too soon and stuff, and I was also having different ideas. I'm like, you know what, this study normally takes about 10 years to be completed and things like that. But I had to also do my own investigations. Being in the industry, I'm not biased because I'm in the industry and stuff, so I had to also do my own investigation. And what I learned as well as it developed, like I said earlier on, there are independent bodies in the pharmaceutical industry like MHRA. So they went through everything, to just to check how they developed this medicine and stuff, side effects, and any medicine will always have side effects. So they covered everything. And the other thing I want to tell people as well is that yes, it was developed on existing technology, which was used on previous SARS cases and stuff. So it wasn't something new. And the world also put a lot of money on it because we were affected by it globally. So it was like an urgent case. So we had to do something as a people, you see. And there is no microchip in that medicine because microchip is something that we can see with our eyes. So, we'll be talking of nano. So that's what people need to understand. Yes, I do understand, the worries and stuff, even like in churches and stuff, 666 and stuff. When you read the Bible, there are signs, telling signs and stuff. But for this one, there's no microchip. It's not is it 666 sign? I don't believe that. So yes, let's not also bash the people that are also worried or skeptical, because I was also skeptical. So respect our pastors, we can get it wrong as a people and stuff. So yeah, that's all I have to say about that. Let's make informed decisions and let's
Thank
learn
you.
from one another. Thank you, Chido.
Thank you, Kaisa. Thank you so much. And let me just read 2 comments that just came in before I say my own and then say my goodbyes and thanking you guys for coming. So Blessing said, people should not quickly dismiss the fears of others, but should listen attentively and advise as some of the health professionals, they are the ones who are on the forefront to discourage others. Wow. Did you hear that? Apparently, we discourage people instead of encourage people to talk openly and not judge people. And then the other one, studies also indicate that BAME healthcare workers show lower vaccine uptake. This was a report from England in 2019. I don't know about that one. That could form our conversation for the next one when we do the vaccine conversation. Maybe we can read around that interesting comment. Yeah. So I'll just say my few, what I think we should do. This is the month of mental health, last day. The theme this year was nature. So what everybody has been doing in other organizations is to encourage people to go out, go for a walk. The sun was out today. Don't stay indoors. We've been indoors for 1 year. Try to just go to the park. Fresh air does amazing things to us. And also exercise. I love exercising. Go to the gym. I'm not saying everybody let's go to the gym. Please pick the one that fits you. Yeah. So some studies say exercise is good for mental health. And you also statistically 1 in 4 has mental health. So that's another thing you need to know. So that stigma and discrimination, I don't think this is why we're doing this conversation, to break the stigma, to make this a normal conversation, and then help each other to find ways to manage this. So on that note, I'd like to thank everybody, Emily, Sandra, Misha, Kenza, for this amazing conversation and for allowing me to take over House of Africa for today. And hopefully you'll give me another opportunity so that we can continue such conversation, which I'm passionate about this conversation, and also to be able to inform people on what we're passionate about, empower each other through this conversation. And thank you so much. And goodbye, everybody. Until next time. Thank you.
Thank you.
Thank you so
We're
much.
all leaders. We're all leaders.
Thank you, guys.
Bye.
Am I off the show? Leave studio.